Okay, we are live. Hi, I'm Bill, the knee pain guru, the best in the world at eliminating knee pain without drugs, shots, or surgery. Today's webinar, we're going to go over getting rid of patella pain the right way. That is, getting rid of patella pain or kneecap pain the right way. So if you're looking to get rid of the pain in your kneecap area, patella, then you're in the right place. First of all, I'd like to welcome you this evening. This is going to be an amazing webinar. I'd like to go over a few things before we get started to make sure you get the very most out of this evening. First of all, I'd like you to turn off all distractions. Your cell phone, if you have other browser windows open, close the door to the room that you're at, and get out a pen and a piece of paper, because there's going to be some information that I'm going to share with you this evening that can absolutely transform how your knees feel if you take action on them. And also, I'd encourage you to start leaving your questions below. If there's questions, let's see, I'm gonna leave your questions. I'm gonna leave your questions below. So that should be up below. So if you have any questions about what's going on with your knees, the situation with your kneecap, pain that you have in your patella, whatever the case is, leave them below and I'll answer those at the very end of the webinar. Let me get my notes here to keep me on track, because otherwise I will go all over the place. Okay. So getting rid of patella or kneecap pain the right way. In today's webinar, you're going to learn what not to do. And that's really very important. I've worked with a lot of people over the past 16 years, ever since my own knee injury, and anywhere from people who have had surgery on their kneecap, ligament reconstruction, just fell on the knee, chondromalacia. There's a lot of issues that go on with the knee. And a lot of times people are doing the wrong thing that are actually keeping them in pain longer. They're causing the problems that they're actually trying to get away from. And a lot of times what you've been told is wrong. And it's not that the people that are telling you are doing it intentionally, they just don't know any better. They don't understand the body on a deep enough level. So first of all, once again, my name is Bill Paravano, the knee pain guru. I got into this back in 1999. I had dislocated my left knee 4 times. My learning curve was actually quite flat. I injured it in skiing the first time, then I dislocated it again in judo, in volleyball, and then finally softball. So I went through this really painful experience of tearing the ligament in my left knee 4 separate times and had 2 pieces of meniscus taken out of the knee during the surgery. And that experience put me on a completely different path in my life. And it was something that it was my passion to get back on the judo mat. I loved throwing people. That was my absolute, what I lived for. And I was kicking myself in the butt that I was doing other things like skiing and volleyball and softball that injured my knee in a way that I wasn't able to get back out on the judo mat. So my drive to get my knee back whole again, so I wasn't limping, so I didn't feel like I was 80 years old when I was in my late 20s, was purely out of the fact that I wanted to get back out on the judo mat again. I wanted to compete. I wanted to train. I wanted to throw people. So my passion and desire and drive came from that That was my why, which brings me to another piece that I want to share with you this evening, is that we need to figure out what your why is. Or actually, you need to figure out what your why is. You have to summon a deeper reason for why you want to get out of pain, why you want your knees not to hurt anymore. And if we don't have that why, we don't have that drive, then what ends up happening is we don't have enough to sustain us when it gets difficult, when it gets challenging, when the knee pain comes back again, because it's inevitably going to do so. So my why was judo. My why was throwing people. You have to find what you're committed to. And here's some questions to ask yourself. How committed are you to eliminating the pain in your knee? How committed are you to having your legs respond to you in a way that you want? So you can kneel, so you can squat, so you can play with your children or your grandchildren, so you can run, you can bike, play tennis, golf. How committed are you to getting your knee to that place? And how committed are you to living the life that you want to live without thinking about your knees? Because that's one of the things that I run into with people that I talk to about what's going on with their knees. Yeah, they want to get their knees out of pain, but they're not so committed. Now, I promise, a number of you, there's right now, there are 84 people on the call. And I promise you, a number of you will not take action. And it's not because what I'm saying isn't good. Like, the information is going to make complete sense. But there's things that are going to come up. Something's more important. I don't have time for it. And what ends up happening is you stay in pain longer than you need to. And it's all because the priority isn't there. So when we find that deeper reason, that commitment, that level to why you want to get your knees out of pain, when we get real clear on that, then it makes how you're going to do it so much easier. And at the end of the call, I definitely want to reward those who take action. You may be sitting there saying, well, Bill's going to try to sell me something. And I don't want to disappoint you. I am going to try to sell you something. But if I didn't fully believe in what I had to offer was going to help you, then I wouldn't even mention it. Because this is something I've committed my life to. So the big part of what we need to address is getting an understanding of the anatomy of the knee. The patella, also known as the kneecap, and you also have your patella tendon, which holds your kneecap in place. And this is the area that we're really going to focus on today. There's tension patterns that develop in the body as a result of accidents, injuries, repetitive motion, or lack of strength that causes the irritation of the nerves in the patella tendon or in the patella in the kneecap itself. And what happens is it causes when the nerves get irritated like that, it causes the pain that you experience. For instance, one of the big kneecap issues is called chondromalacia. And that's where there's a grating of the back of the kneecap up against the bones in the legs, the bone in the upper leg and the bones in the lower leg. And it causes like a fraying of the cartilage that's behind the kneecap. And it's very, very painful. As a matter of fact, I was working with Ricardo. He was a rugby player out of Italy. And that was one of the things that we really addressed with him. He had incredible kneecap pain. And we had to get the pressure off of what was going on with that kneecap. So the big thing, there's 3 common causes of kneecap pain, of patella pain. And one is caused by an impact of the patella, of the kneecap. This is where you slip on ice or you trip and you fall and you smack your kneecap. And when you smack that kneecap, there's an inflammation, there's a swelling, there's a tenderness that can take place in the kneecap. Sometimes you may hear that the bursa or the sac that is in the knee is damaged. And when that happens, it causes inflammation, it causes swelling, it causes problems. So you have this fullness in the knee, it's difficulty bending the knee, and it just hurts in general. The second cause is caused by overuse. And that's where, if you're a runner, you play tennis, you work out a lot, we have a stress pattern, a tension pattern that develops in the kneecap as a result of overusing the knee. Too much tension and stress. This would be diagnosed as patella tendinitis, patella femoral syndrome. Chondromalacia is another one. I had just mentioned that a bit ago. And that comes from an overuse pattern of what's going on in the knee. And the third type of pain that happens as a result of the kneecap is when the kneecap dislocates. And I worked with a Border Patrol agent out of Australia. His name was Vinny. And what happened was the patella tendon that holds the kneecap in place wasn't strong enough. So the kneecap kept flopping out. Whenever he'd get into a weird position, the kneecap would dislocate and it would cause a different type of pain, although it was all focused around the kneecap. Sometimes that's as a result of the groove in the kneecap behind the kneecap isn't deep enough. So what happens is the kneecap can pop out. So those are the 3 types we're going to cover tonight. The impact, you fell on your knee and now your kneecap hurts. You have overuse, you've been straining it because you've been pushing yourself in sports or physical activities like work and things like that. You overuse the kneecap or the knee and it causes pain. And then the third one is the kneecap dislocates. So the first one we're going to go over is impact pain. This is, like I said, when you fall and now the kneecap hurts. The common conventional approach we're going to look at is RICE therapy. That's rest, ice, compression, and elevation. And this is a very common therapy. It can be very beneficial. But what it's not considering is the nervous system. You see, there's going to be 2 aspects of this injury. One is the actual impact of the injury itself, and it causes a swelling and inflammation and pain. But you also have this other part that happens simultaneously. So you have this swelling, inflammation, and pain that are happening at the same time as your nervous system is tensing up to protect the knee from getting injured further. When you're falling, you know what's happening, and all of a sudden it's like your body tenses up to protect itself. Well, that's functional for the injury, but it's dysfunctional for you to go into your life and optimize the body's ability to heal the kneecap. So it's kind of like the pucker factor goes up a whole bunch. So you have the swelling and inflammation and you have the body tensing up. And when the conventional approach to addressing it would be like Tylenol, Advil, Nuprin, to mask the pain enough so the body can begin to get an edge on healing what's going on. But what ends up happening is we don't take into consideration this tension pattern, this pattern that the body tensed up to protect itself. So even after the swelling and inflammation may have gone down, we still have this pattern that's going on that feels like there's a restriction in your movement. Your body is unable to move as easily and smooth and fluidly as you would like because it's affecting how we think about our knees, how we feel about our knees. And what ends up happening is it affects the speed at which the body can heal. So in order to really do that, we have to look at the energetic component that's going on for what the body is doing to protect itself. And if we disregard that, if we leave it off the table, we leave a lot to be desired. And that's why so many people, even after their knee heals, like the injury was weeks and months and years ago, they're still having trouble with the knee, and they can't understand why, because it doesn't show up on an X-ray, a CT scan, or an MRI. It's like there's something going on with the knee, but I can't put my finger on it. It's because it's what we're feeling that's not being addressed. We have to address what the body feels. And when we begin to understand that, because the body right now is feeling pain, we have to begin to shift that focus from thinking about, like, what do we think is going to get the knee out of pain, exercises and sets and reps, to how does the body feel? How do we feel to get the body out of pain? Because after so many days and weeks and months and years of ignoring how the knee has felt, it's finally got to a level where we can no longer deal with it. We have to feel our way to get out of that place. So in order to address the impact pain, falling on our knee, do the rice therapy. And you can do the Tylenol, the Advil, the Nuprin for a short period of time, but we have to have a better strategy. We have to have an approach that is going to set the body up so it can heal what's going on. And what I'm talking about is getting the pressure off of the nerves in the knee. And we're going to do what I refer to as a passive stretch in a little bit. I'm going to get through the overuse pain and the dislocation, actually just the overuse pain. And then we're going to get to that stretch, because the impact pain and the overuse pain are going to have a similar way to address what's going on. And we'll get to that in just a moment. Now we're going to move on to the overuse pain. And for those that just joined us, this webinar is focusing specifically on the getting rid of patella pain the right way. And if you have questions as I'm going through this, ask your questions down below. There is a box down there that you can ask your questions. So go ahead and post those below, and I will get to those at the end of the webinar. So now we're moving on to the overuse pain. So this is going to be a repetitive motion type of pain. Once again, patella tendonitis, patellofemoral syndrome, chondromalacia are some of the more common repetitive motion pains that actually I see quite often in the kneecap. And what is going on is there's an imbalance of tension in the knee. The body, you think of the entire body, not only the knee, but the body is a series of pulleys and levers. The body is a series of pulleys and levers. And when one of these areas of the body tenses up, it creates an imbalance. And that imbalance can cause a wearing. You could think of it very much like an accident. You get into a car accident, and the frame gets bent a little bit. So it causes the tires to wear in a different pattern or in a different way. And the body functions in a very similar way. One of the examples I used in the emails I sent out this week was carrying a bucket of water for a long distance. So we have that bucket of water and we tense up our shoulders and we bend our arms. And when we walk for, maybe 10, 15 feet, it's not going to be that big of a deal. But if we carried that bucket of water for a half a mile or a mile, what's going to happen is the body is going to lock into this position that when we put the buckets of water down, it's going to kind of hold on to that position for a period of time. When you experience an injury, you experience pain in the knee, what ends up happening is the body locks on this pattern to protect it from getting injured further. This causes an imbalance. Now, this imbalance could be more than just in your knee. It could be in your ankles. It could be in your feet. Like how you're walking is actually affecting the tension that's going up into your knee. It can also be in your hips and your lower back. The way you may have fell and smacked your hip, or you bent over to pick up something and you tweaked your lower back. That causes the tension pattern in the body to shift and can direct that tension down into the knee in a way that can cause your kneecap to hurt. So it's important to understand that when we have these imbalances, these tension patterns that are going on, and it's a repetitive motion kind of pattern that, we're running for over a long period of time, playing soccer, walking for a long period of time, it can cause inflammation. It can cause problems in the patella tendon, in the relationship of the patella tendon to the bone in the upper leg, which would be diagnosed as patellofemoral syndrome. And we can also look at the irritation of the back of the kneecap, like chondromalacia. How your body holds the tension is going to be where the pain is. And it's why the diagnosis is different. Each diagnosis is going to be different based on where the pain is located in the kneecap. And once again, how this is normally treated, we're going to look at Tylenol, we're going to look at Advil, we're going to go look at Nuprin, aspirin possibly. We have anti-inflammatory drugs, which would be like Tylenol with codeine. You have some of the more powerful prescription drugs that would address how to treat the pain in the knee. You could look at cortisone shots, like shots into the knee, to numb the pain, to speed up the healing. We could look at physical therapy. The conventional approach is if we strengthen the muscles in the legs, the knee pain will go away. And in the worst case scenario with your conventional approach, you're looking at like an exploratory surgery. Nothing comes up on an X-ray, a CT scan, or an MRI. So they do an exploratory surgery to see maybe they can find out what's going on in the kneecap that is creating the problem. All of these approaches are kind of the ones as far as numbing the pain is like a Band-Aid on the issue. It's not really addressing the source. And the conventional thinking is if we numb the pain for a period of time, that we give the nervous system an opportunity to respond, an opportunity to heal what's going on. Unfortunately, what happens is when we numb the pain and we don't feel it, we can actually do more damage. We can cause more problems because we're moving in a way that is not letting the body know that there's something wrong. And that's where we can actually make the situation worse in the knee. You have a cortisone shot and the pain has gone away, but now you're walking in a way that's actually irritating the nerves, but you can't feel the nerves. or the numbing of the pain with Tylenol, Advil, Nuprin, or maybe a stronger prescription drug that causes an issue in the long term. And I believe that's why there's so many people lining up for knee replacement surgeries down the road, is because we aren't addressing what's going on beforehand. We have to look at the sustainability and longevity of the joint in order to set up the conditions so we have the same joints our entire life. One of the big things that I have with the conventional approach is that all of these drugs that are designed to numb the pain are synthetic chemicals. And the synthetic chemicals put a taxing on our organs. So our body has to process these synthetic chemicals, numbing the pain, and it's also causing our liver to work harder and essentially our system to be polluted. And that just, in my mind, it's not getting us closer to what you really want. And that's when we go back to your commitment. What do you want? You want to be able to enjoy your life. You want to be able to move without thinking about your knee. You want to be able to golf and play tennis and run and hike and do all of those activities you did before the knee injury. So when I think about numbing the pain and exploratory surgery and shots in the knee, it's not really working in the long term. Otherwise, there wouldn't be so many people that are still in pain. So my approach is going to be addressing the body in a very specific way, looking at our mindset. And we started working on that a little bit before with our commitment. We have to get our head in the game so we can play. If the head's not in the game, then there's no sense in even stepping forward on the court or on the field, because we're not in a place to be able to address what's going on. The next is water and nutrition. The body needs to be properly hydrated. We're supposed to be made up of 80% water. And when we don't have enough water, and this is evidenced in Dr. Batman Geldage's book. He's an Iranian doctor that did a study for 20 years on the effects of chronic dehydration in the body and treated his patients with just plain tap water. And he found that chronic dehydration can affect the joints in a very terrible way. It sets up the conditions for arthritis to set in and the joint to begin to wear away. So water is very important. We need to make sure we have that. We have to have the nutrition. The body needs the fuel that is required to get the results so the body can heal. If you put in poor fuel in a race car, like in a Formula One race car, you put in a regular unleaded gasoline, you're going to get horrible performance out of a car that is designed to go a couple 100 miles an hour. So we need to put in the right fuel in our gas tank. Natural, local, organic, fresh foods that don't have labels on them are ideal for the body to use to heal what's going on in the knee. Breathing. If we hold our breath, the body tenses up more. When the body tenses up more, it interferes with the nerves. And when the nerves are interfered with, it causes more pain. So you can sit there listening to my words and you hold your breath, your body will get more tense naturally. It's just a natural part of who we are as humans. So by beginning to breathe in through your nose and out through your mouth, what happens is you relax the tension in the body. You make more space for those tiny little nerves that are the width of an eyelash that are creating the pain in your kneecap. And that's one of the other pieces to the puzzle in order to getting yourself out of pain. But the part that I really want to share with you is the comfort piece. And this is, we're going to do an exercise here. or actually it's a stretch. I call it a passive stretch here in just a couple of minutes. And when we create comfort in the knee, what happens is we get the pressure off of the nerves, and the experience of relief is immediate. And that's what I want you to experience this evening, is that experience of comfort in your kneecap. So I want to share that with you. I'm pretty excited about that. Let's see. I want to make sure, the camera, we're able to video what I'm going to show you here. So we're going to work with the kneecap, with your kneecap, in a way to take it in a position of comfort to get the pressure off of those nerves. I want to make sure you're asking the questions. Let's see. There we are. Okay. So we got a few questions in there. I want you to begin to ask your questions as we get into the webinar to be able to clear up anything that I'm saying that isn't making sense, so we can dial it right in so you really get the most out of what I'm sharing this evening. Okay, so now I'm going to move this camera. We're going to get the camera over where we can work on the kneecap. Let's see. So what I want you to do is sit down and I want you to get your legs straight. Let's see. This could work really well, or it can be pretty miserable. There's a good shot of my knee. What we're doing is I want your knee straight so you're able to loosen, so your kneecap is loose like this. And what I want you to do is begin to see, I'm going to push the kneecap in, and I'm going to push the kneecap out. And I want you to pay attention to which direction goes easier, is less tight, less tender, less painful. So for me, if I push it out, it goes. And then when I push it in, actually it goes a lot easier in. So what I'm going to do is I'm going to push the kneecap in, and then I'm going to do gentle pressure in this position of comfort and hold it here for 30 seconds to a minute. The key here is if it causes pain, we aren't doing it. So I'm guessing we're about at 30 seconds. I'm going to let the pressure off of my hand, and then I'm going to go back and I'm going to check the range of motion in the kneecap. And it does feel different. And you're going to do this side to side. You're going to do it down and up. You're going to do it on the diagonals. And you're also going to do it clockwise and counterclockwise. Those are all of the different directions that the kneecap can hold a tension pattern that creates the pain in the kneecap. So work with that. Begin working with those. Go down and up. See which one is easier. Remember, this is comfortable. Let's see. So we're going to push the kneecap down, pull it up. And mine goes way easier up. I'm going to put gentle pressure down as I'm holding the kneecap in a position that is up. I can also look for cues from my nervous system, my breathing changing, my mind wandering, my shoulders dropping. And when that happens, then I let up and I check and see if that's different. Be real gentle. If your kneecap is really sensitive, then you're going to want to go in a smaller range of motion. So if it really hurts, then it's almost going to be imperceptible. I'll push the kneecap in, and then I'll push it out. So I want to work with that in a position of comfort. But this is the stretch. I refer to it as passive stretching, and it begins to change the neurology of the knee, the tension pattern in the knee of how the knee is holding that dysfunctional pattern that is causing the pain. When we begin to focus on comfort, what we focus on expands. The more we focus on comfort, we create more of a reality of comfort, and comfort begins to shift and change in the body. We gain more of an awareness outside of the knee, because when the knee is painful, all we're doing is focusing on the pain that the knee feels. But when we focus on comfort, now we focus on all the other possibilities, the infinite amount of possibilities that creates a new reality for the kneecap. So make sure, if you're having questions around that, try this out because I'm going to continue the discussion here. Work with this, work with your kneecap in a position of comfort, ask me questions, and we will get to those at the end of the webinar. So I'm going to move the camera back. And here we go. Okay. There we go. And that is... So that is working with the knee in a position of comfort. Actually, there's lots of different ways to work with the patterns that develop. As the pattern shifts and changes, we have the bones in the lower leg we can work with. We have the bone in the upper leg we can work with. There's the tension pattern in the hips and the lower back, the ankles and the feet. So all of these go into play in terms of how the tension goes into the kneecap and creates the pain that is going on in the kneecap. Okay, the third type of pain can come from dislocation of the kneecap. And what's happening is there's not enough tension holding the kneecap in the right place. So you could think of the patella tendon as being kind of sloppy. The patella tendon isn't strong enough to hold the kneecap in place. So like I was telling you about my client Vinny that I worked with several years ago, whenever he would twist a certain way or bend his knee a certain way, the kneecap would pop out, and it was extremely painful for him. So it caused all sorts of hesitation. He didn't want to step a certain way. He didn't want to move a certain way because he knew if he did, it was going to be painful or the kneecap would dislocate, and then it would just be awful for him. He ended up having 2 surgeries as a way of correcting the kneecap dislocating. But he still had lots of problems with the kneecap when I first started working with him, because he not only was dealing with the kneecap dislocating because the surgeries didn't correct it, he also had lots of issues with scar tissue buildup in the kneecap as a result of the surgery that really didn't work. If nothing is broken or torn in the knee, then many times surgery is not helpful. Many times surgery sets can set you back a significant amount. And it's something that I would never go into, is getting a surgery if nothing was broken or torn in the knee. And that's one of the common suggestions for a kneecap dislocating, is that surgery is recommended. But it's not addressing the tension in the tendon, because the tendon still ends up being weak. So the answer to it, my approach, is going to be strengthening the tendons. And there's a specific way of strengthening tendons than there is strengthening muscles. Many people get into the idea that if we do sets and reps in your conventional physical therapy, that it's going to strengthen the muscles in the legs that cause the stability in the knee. But there are no muscles in the knee. If you look on an anatomy chart, you go into any physical therapist's office or doctor's office, they'll have the muscle anatomy chart, and the muscles are all in red, and the bones and the tendons and ligaments and fascia are in white. And if you look at the muscle anatomy chart, the in and around the knee is all in white, which means there are no muscles. That's why strengthening the knee joint is very different than strengthening the muscles in the legs. So in order to understand how to strengthen the knee joint, we have to understand the difference between muscles and tendons and ligaments. Muscles initiate a movement. So when you walk, your movement is initiated by a muscle firing or a series of muscles firing. But those muscles get fatigued after 7 seconds. You can see this if you go into a gym and you got the guy on the bench press, and he gets the weight off the rack and brings it down to his chest and then pushes it back up. It'll generally, after 6 to 7 seconds, you can count it. If he's really maxing out, if he doesn't get that weight up, it's not going up because his muscles are going to fatigue. That's why sprinters are real big, but long distance runners are skinny. They're real sinewy. They have lots of tendons and ligaments. So to strengthen the muscles the tendons and ligaments in the knee joint, we have to fatigue the muscles and get the muscles out of the way. And what's left is what we build up with tendons and ligaments. However, there's a common idea that when the body's muscles fatigue, the body starts to shake. That's generally when we stop doing the exercise. And if we are doing the exercise with weight, we make the joint very vulnerable to injury, because now the joint isn't being supported and we're doing weight that the body isn't designed to handle. So in order to strengthen the tendons and ligaments in the joint, we have to use body weight exercises, and we have to do them long enough to get the muscles out of the way, to fatigue the muscles and just work on tendons and ligaments. When we do that, we have to make sure we're breathing properly in through our nose and out through our mouth. Now, this is one of those exercises. This is one of those exercises that is going to be very physically challenging, and I refer to it as a slow squat. And I think we could pull it off here. I'm going to need to move a few things out of the way. And I'll show you exactly how we do this. So this is going to be specifically for someone with a loose patella. The patella tendon is dislocating, that the groove isn't deep enough, or the tendons and ligaments are weak in the knee joint. And this is going to be, it's an amazing, amazing exercise, but it's also very challenging. So what we're going to do is we're going to go down very slowly. We're going to take about 30 seconds to go down, 30 seconds to come back up. And we want to make sure we're breathing in through our nose and out through our mouth. In doing so, we have to keep our posture right. Now, I'll demonstrate everything, but I just want to give you an idea of how we're doing this. So let's see here. Okay. You're not going to get the whole shot here, but this will be good. Okay, so we're going to do a slow squat. We're going to want to have our knees bent, our pelvis tucked underneath, and our feet about hips width apart. Have our shoulders relaxed, and we're going to begin breathing in through our nose and out through our mouth. And we're going to go down slowly. And when it gets more difficult, that's when we want to breathe faster. So as we're going down, we're going to start breathing a little bit faster. And we're going to get to the bottom. We're going to rock a little bit, which will be helpful, loosening up the hip cradle. And then we're going to go back up. So that exercise, what that's going to do is as we slow down the movement and we fatigue the muscles in the legs, we're going to feel the legs start to shake. This is exactly where we want to be in terms of strengthening the tendons and ligaments in the knee joint in order to stabilize what's going on in the patella tendon. It's going to be phenomenal as far as getting that real strong and getting solid stability in the knees. So that's how we deal with kneecap dislocations when there's not enough tension in the knee joint. Let's see. Okay. So that is going to be the approach that I would use for, just to recap real quick. We went over the impact pain and the overuse pain, and taking the kneecap to a position of comfort is going to be the highest leverage thing to get it out of pain and to optimize the body's ability to heal. So we want to use comfort in that case. For the kneecap dislocating, when there's not enough tension in the patella tendon holding the kneecap in place, we're going to want to use a slow squat. We're going to want to get the muscles out of the way and focus on strengthening tendons and ligaments. Sets and reps will not get you there. That's really important. I really want you to get that takeaway when you have dislocation pain, that type of thing. So what I want to share with you is, let's see, a lot of times people say, well, this is pretty simple. It's simple stuff. This is not very complicated. And to be honest, it's not. What's most challenging about it is the fact that this goes back to what I was saying, getting in pain, we've ignored what's been going on for a long period of time. We've not paid attention to when the knee hurt. So we ignored it and the pain level went up. And we ignored this and the pain level went up. And we ignored that and the pain level went up. So finally, we've gotten to a place that we can't ignore the pain anymore. It hurts too much no matter how we move. So the conventional approach is, well, we got to think how to get out of pain. How do I get out of pain? But we can't think about it. We have to feel our way out of pain. And that's where I have some programs that are very beneficial in terms of providing that support for you to help you move in a direction of getting out of pain and staying out of pain. And the course that I want to share with you, and I'm going to put this up on the right next here. Let's see, display offer. It should be posted there. It's called my Say No to Knee Replacement Webinar Special. And that is a comprehensive program. I've spent the past 16 years really refining, working with clients and finding what is the most effective way of getting them out of pain. And I've distilled that down into a program that is the essence of what you need to know. I cover the mindset, the water, the nutrition, the breathing, all of the components that you need to know in order to optimize the body's ability to heal what's going on and get the body out of pain. I also go into comfort. Comfort is a huge piece in this program, and you're designed by gauging your pain level on a scale from 1 to 10. And whatever your pain level is, you work with the modules that correspond with that pain level. As the pain level decreases, you evolve to new modules. And the whole point of it is that you continue to work your pain level down to it doesn't exist anymore. Now, this program is online. It normally runs for $697. But for being on the call today, I have a great discount, and I really want you to take action on this because this is so important that you begin to change your life. This goes back to that commitment. What commitment did you make when we started the webinar? And what is most important to you? What's your why? You know, for me right now, I have an 18-month-old daughter. Her name is Evie. And that's like my why. Everything is about that. If I couldn't get on the ground and play with her, oh my gosh, that would just be awful for me right now. So by determining your why is going to really give you an indication of how important this is to you in moving to a place of eliminating your pain. Now, what I'm also going to throw in today as a result of this this special webinar, the webinar special, is 1 month in my Knees for Life Inner Circle. Now, that is where you get the membership site of all the videos that I've created working with clients one-on-one. There's also 2 Google Hangouts that I offer per month, and that's where you're able to interact with me one-on-one. Like, we're working on a call together for your knees, where I'm distilling down exactly what stretches, what you need to focus on in the next short term to move you in a place so your body can heal what's going on in your knees. There's also a private Facebook group where you have the community of other people who are also on a path to alleviating the pain in their knees. So you get all of this, the Say No to Knee Replacement. You get the Knees for Life Inner Circle for a month. You get the private Facebook group and my virtual clinic, which is my membership site that I work with clients one-on-one. All of that, the program itself goes for $697. The Knees for Life Inner Circle goes for $97 per month. I'm offering a $200 special on $200 off of that price today. So that would be $497 special. You go over to the link right next to the video here. You click on that link. It'll take you to the sales page. You go down to the bottom and you can sign up and be in that program in the next 5 minutes. Now, that special is only available for the next 48 hours. I'm offering that $200 off for the next 48 hours. So now we are going to go on to the questions. And I saw there were some questions coming in. Okay. Okay, Sherry said, tried the squat, but only go halfway down. Do I need to keep pushing? Had scope of the right knee late November of 2014, 2 meniscus tears repaired, but still have swelling and pain across under the patella. Any ideas? Yes. Sherry, don't do the squat first. Exercise is not going to get you closer to being out of pain. What we want to do is create comfort first. That's why it was with the repetitive motion pain or the impact pain, we want to create comfort first, whereas the kneecap dislocation is going to be more for the exercise to strengthen the tendons in there. So you think of it like a recipe. We have to have the right ingredients in the right amounts, in the right order, with the right timing. So with your lack of flexibility going down because of, the body protecting itself, we need to focus on comfort, get the body out of pain, set up the conditions with water, nutrition, and breathing. And of course, make sure the mindset is right, but really focus on comfort to get the body to feel safe, supported, listened to, so it can expand. So your comfortable range of motion expands. And then we could then move on to exercise down the road. Like that exercise will be there, but you're going to get more leverage out of exercise when you're out of pain than if you're trying to exercise while you're in pain. Does that make sense? And if it doesn't, ask another question. Totally get to it. Okay. Kathy asked, can I administer this therapy successfully even though my job is very physical? I'm not totally understanding the question. Is the therapy successfully? Like if you have a moment to sit down and work on your knee, absolutely. This is going to be helpful. Now, if you get the knee in comfort and then go back and you have to work again, then you're going to take on that tension pattern that you were just trying to get rid of. So it's not going to last that long. However, here's some tips and some tricks that you could use that'll maximize the body's ability to feel better longer. Is work on your knee, spend time like 10 to 15 minutes in the evening after you get off of work. So now your knee is relaxed, then you go to sleep for 8 hours. Your kneecap is comfortable right after you get out of work and until you need to go to work the next day. So this is a way I work with clients to use their specific situation as a way of optimizing their body's ability to heal what's going on. For instance, I had, what was his name? Edward. He was out of California, and he was saying how he would work on his knees in church because he was just sitting there, and he was able to, when he felt pain in his knee, he was able to just sit there and work on his knee, get his knee out of pain. No one would really know the difference. He just had his hand on his knees, but it's just what we can do in the different situations in our lives that we can create comfort and allow the body, optimize the body's ability to heal. Okay, so Kathy, if there's another angle to your question that I didn't quite get, then please ask that. And for those, if you still want anyone else, I see there's a bunch of people on the call still. Ask your questions below in the chat box or maybe on the side. I'm not quite sure, but leave your question there and I will get to it. Okay. Does a problem with the patella, Anne asks, does a problem with the patella contribute to not being able to fully extend my knee? It can, but most likely it has to do with what is referred to as a femur override. Femur is the bone in your upper leg, and the femur, so if this is the bone, wait a minute, let me do it this way. If this is the bone in your upper leg, and this is the bone in your lower leg, the femur will be over the top of the bone in your lower leg. So when you try to extend your leg, the bones are hitting each other. And that's most common, like if you take a step, like going down the stairs, and the lower part of your leg stops, and the upper part of your leg slides over a little bit, that can cause a femur override. You could think of like a soccer player or a basketball player. They're running down the field really fast, really fast, really fast, and then they stop. And what happens is the foot stops, and then the lower part of the leg stops, and then the upper part of the leg slides just slightly over the top of the lower leg. And that creates a pattern that's going on in the leg that makes it difficult to extend the leg without pain, or even extend the leg fully. That's something I go into. A lot of the passive stretches that I talk about in that program, Say No to Knee Replacement, are going to address that. The forward and back stretch, the rotation stretch, the plant and pull is another one that's really big in terms of addressing that forward and back motion in the knee that allows the pattern to free up and get the leg to extend fully. That was actually an issue I had. That was huge after my patella. They took part of my patella tendon out in order to reconstruct the ligament in my knee. And they took out 2 pieces of meniscus. So that was a pattern that was going on in my knee where I had to bend it. You know, you're limping around, you're on your toes on that side. So I had tension in the hip, the knee, all the way down. It was a mess. But that was a very common pattern I see. Okay, let's see. Devontae, I'm a football player in college. I've had ACL surgery last year where they used a patella graft to repair my ACL. Man after my own heart. Oh my gosh. Same thing they did with me, patella tendon. I'm still experiencing patella pain before, during, and after workouts. My athletic trainer suggests doing eccentric exercises to strengthen the tendon, and that will relieve the pain. Is this safe to relieve the pain? What should I do? Okay. The exercises to strengthen the tendon, I believe the exercises are going to strengthen the tendon. What isn't being addressed is the nerves that are irritating. And this is what I think I was talking with answered one of the questions before, that the nerves are being irritated. And with the scar tissue, when they cut through the patella tendon to take that graft out to reconstruct the ligament in the knee, they cut through skin and tendon, you know, so it's like there's a lot of damage. The scar tissue that's growing back is part of what's interfering on the nerves, and it's real sensitive. So part of working with it is we want to address the tension patterns in the patella tendon where the scar is on a very subtle level. And you can work with that like you're sitting in class and things like that. But there's a specific stretch in the Say No to Knee Replacement program that works with the scar tissue, just working with the scar tissue. And that would be very subtle, very gentle, and you're going to get a lot of leverage out of there. One of the things that I found out when I dislocated my knee when I was throwing to first base. So this was my left knee, and it ended up being an external rotation of my femur. Now this was really cool, and I've never heard anyone talk about this anywhere else. There was an external rotation of the femur bone, the bone in the upper leg, which caused the scar to be dead center on the patella tendon. So when they did the surgery, my leg was stuck in an externally rotated place. But when I released the tension in the femur, the scar tissue or the scar shifted a 1/4 inch. So it was no longer dead center on my knee. And it allowed me to kneel when I went back to judo, which was, I was thrilled because the scar tissue was so tender. So I would work both with the scar tissue passive stretch, the passive stretch of the external rotation of the femur, as well as the rotational stretch of the lower part of the leg, the tibia and the fibula. And I think combination of those is going to free up a lot, where what you're going to feel in the scar tissue is going to help you a whole lot in terms of being able to build up the tendon easier, because it's not going to hurt so much, and get you back to playing and performing like you were before. So Devontae, that would be the angle of what I would point you towards. Work in the program, the Say No to Knee Replacement program, get into the passive stretches, those 3 specifically. The external, the femur rotation, the rotation of the lower part of the leg, and the scar tissue. Those 3 passive stretches. You're going to get the most bang for your buck there. Okay, Daniel. Daniel asks, I can move my patella in every direction except up and down. What can I do to loosen it? Great question. By focusing in the position of comfort, by focusing in the area where the knee is comfortable, what we focus on expands. Comfort expands. So keep working with that passive stretch with the kneecap in the directions you can work with, and eventually what's going to happen is that can free up going up and down. If the pattern is just in the patella tendon, if the pattern's not in the patella tendon, meaning it could be something going on, like I was talking about the femur override before, or there's also a femur underride, tension patterns that are going on with the tibia and the fibula, which are the bones in the lower leg, or the femur, which is the bone in the upper leg, those can affect the ability of the kneecap to slide up and down. So working with those different stretches in the Say No to Knee Replacement program is going to be beneficial for you to loosening that up, in addition to just working with the patella, with the kneecap itself. So definitely work with that. Let me know how that goes. Okay. That was the last question that I have so far. If there's anyone else that has questions, ask them. For those, definitely go down and get involved in the Say No to Knee Replacement program. That is, like I said, it's a $697 program. I'm knocking $200 off of it right now. For the next 48 hours until I believe it's, let's see, what is Wednesday, Friday evening. And get involved in that. You also get 1 month in the Knees for Life Inner Circle, the ability to work with me one-on-one, and I'll zero in on exactly what is going to be the highest leverage to help you out with your knees. I'm going to double check and see if there's any more questions there. That is it. Well, I want to thank everyone for showing up this evening. Thank you so much for allowing me to do this work. I love it. It is just so exciting to see people get their life back, get their passion back. Because when you have knee pain and you don't feel like you have any options, and you're just going down this road that is just more pain, more tension, more discomfort, you lose hope. And I don't want you to lose hope. I want you to know that there is an option out there, and I can definitely help you with that. So thank you so much, and I will see you next time.